Welcome to our office. I'm Liz Asai.
And I'm Elliot Swart.
And we co-founded a teledermatology startup called 3Derm.
So how did this all start?
Well, we met in 2009 at Yale University.
Our first real engineering project together was a laparoscopic surgical probe.
With a very reasonable budget of $1,000.
We definitely could have done it, but 3Derm really got started with a CMIT prize for primary health care. Only problem was the laparoscopic surgical probe didn't fit the bill.
So after brainstorming a number of primary care ideas, we realized that we had both completed skin cancer research in high school.
And that's how the 3Derm Imager was born, the 3D photo booth for moles.
We knew we had an interesting piece of technology, but we didn't realize we had a business until we heard dermatologists say things like this.
I would absolutely use this device.
And that's when we knew we had something.
So, flash forward a couple of years, we won a number of awards, we developed the technology, built a business, even convinced people to give us money.
And that's how we got here today. So Liz, what do you think the most disruptive aspect of 3Derm is?
Well, let's take a step back and tell you just what 3Derm does. We have a handheld imager that takes 3D images of skin at referral sites that are convenient for the patient to access in their day-to-day lives. So the patient goes in, gets a scan, gets sent to a remote dermatologist who makes that review. This is important because when we talk about skin cancer, it's all about early detection. The earlier we can make that diagnosis, the better the outcome for the patient. In the US, our average wait time is 38 days. Melanoma can metastasize in less than a month. This is why 3Derm has a huge potential to disrupt the status quo. How is 3Derm making patients healthier?
Well, people find suspicious lesions on their skin all the time, but then don't get them checked out. 3Derm encourages patients to see skin differently and take an active role in their health care by making exams quick and convenient.
So, what are our goals for the next 5 years? Well, we want to fix the dermatology access issue. With 30,000 patients for every one dermatologist in the US, wait times are incredibly long. By using 3Derm as a triage tool, we can cut down on wait times, reduce healthcare spending, and save lives. So everyone around here knows that our corporate culture relies on our pancake breakfast board meetings and our chocolate consumption. But if you just had a couple buzzwords to describe us, what would you say?
I would say responsible disruption. Dermatology wait times are unacceptably high, and we can't accept the status quo. That being said, we can't just throw out the rule book because we're a startup. We're standing on the shoulders of the FDA, HIPAA, and the American Telemedicine Association dermatology guidelines.
So, while we're a fun and flashy startup,
we had design control documents to make an FDA regulator swoon.
Or something like that. So, come check us out at TEDMED. We're incredibly excited to join you. See you then.